For decades, the medical community has viewed atherosclerosis, the buildup of cholesterol plaque inside your arteries, as a chronic, one-way street. Once the plaque starts forming, the assumption is that it will simply continue to steadily accumulate over time. If you look at the established literature from the world's most prestigious medical journals, the highest therapeutic goal hasn't actually been to cure this condition. The objective is simply to manage the decline, to slow the progression down just enough to delay a fatal heart attack. For a patient, hearing this diagnosis carries a heavy psychological burden. It means accepting that your vascular system is locked into a permanent state of decay, and you will spend the rest of your life managing a disease you can never truly defeat. By focusing strictly on managing the speed of the buildup rather than reversing it, traditional treatment essentially leaves a ticking time bomb inside the patient. In 2014, a patient named Peter Megdal underwent a coronary angiogram that revealed a highly unstable, severe blockage. The scan showed a 60 to 75% restriction at the origin of a diagonal branch. 4 years later, follow-up images showed something defying conventional expectations. That severe blockage had completely vanished. The vessel had become functionally patent. The dangerous narrowing was reduced to less than 10% of the artery's total diameter, allowing blood to flow freely once again. The disease moved in reverse, physically reclaiming the arterial caliber once lost to plaque. When you see a blocked artery suddenly open up like this, the immediate assumption is either surgical intervention, like a mechanical stent physically propping the artery open, or a simple glitch in how the machine was calibrated. To rule out errors, we look at quantitative coronary angiography. It relies on strict physical calibrations. Both the 2014 and 2018 scans were performed on the exact same machine, using identical metrics. Therefore, technological artifacts are completely ruled out, reflecting real biological changes. Furthermore, the data showed a widespread, generalized widening across standardized segments of multiple different arteries, a physiological process known as positive arterial remodeling. This systemic, diffuse widening represents a comprehensive biological healing of the arterial wall. To understand how the body actually pulls this off, we have to look at a single core biological metric, percent atheroma volume, or PAV, which measures the total amount of plaque occupying the arterial wall. This diagram uses a bathtub analogy. The faucet represents cholesterol deposition, lipids pouring into the arterial wall. The drain represents cholesterol efflux, clearing those lipids out. To physically shrink plaque, you must widen the drain, so clearance vastly outpaces deposition. Achieving this sustained net negative volume creates a metabolic environment that forces necrotic cells to clear out, causing the physical mass of plaque to shrink. So, what real-world actions actually trigger this extreme metabolic shift in a living patient? It requires a highly rigorous therapeutic environment known as intensive lifestyle modification. This is a strict protocol built on 3 pillars: a whole foods, plant-based diet, regular moderate exercise, and structured stress management like yoga. Sustained adherence to this demanding environment, championed by pioneers like Dr. Dean Ornish, is the only proven catalyst capable of producing these dramatic angiographic results. We've looked at the structural space inside the artery, but we need to translate that physical widening into a patient's actual survival rate. This chart shows the statistical relationship between plaque volume and severe heart events. For every 1% reduction in percent atheroma volume on the horizontal axis, there is a massive 20% drop in the odds of experiencing a major adverse cardiovascular event. This steep drop in risk happens because the previously unstable, highly inflammatory lesions that cause heart attacks are biologically stabilized and sealed safely within the arterial wall. In 2014, Peter Megdal had a highly vulnerable atherosclerotic profile. By 2018, his arteries were structurally stabilized, moving him into an extremely low-risk category. The human body possesses the biological mechanism to physically heal its own vascular system, provided it receives the rigorous environment needed to activate that process. The Megdal serial angiogram stands as visual proof that heart disease is a reversible condition.